laparoscope is a thin, tube-like instrument with a light and a camera at the end. Veterinarians can use it to look inside your pet's abdomen, or its belly, without making a large cut. It allows them to see your pet's organs on a video screen and perform surgery with small tools through tiny incisions. This, in turn, means less pain and a quicker recovery for your pet. The use of the laparoscope is an option for your dog's surgery, which at this time is being offered only for ovariectomies, or spays, gastropexies, and biopsies. There may be other surgical uses suggested by your veterinarian if they feel it will benefit your pet. Use of the laparoscopic option at Animal Hospital of Statesville requires that your dog weighs at least 20 pounds. At this time, the size of our laparoscopic tools does not allow it to be used with cats. Your pet's laparoscopic surgery will be performed by one of Animal Hospital of Statesville's veterinary surgeons specially trained in the use of the laparoscope. Like any of our surgeries requiring anesthesia, we ask that your pet not eat anything after 10 p.m. the night before surgery. Water is fine. Otherwise, there is nothing else special you need to do to prepare your pet for laparoscopic surgery. We prep the patient in much the same way as for open or traditional surgeries. We pre-medicate your pet to relax them pre-surgery, which also helps them wake up more smoothly post-surgery. Once the pre-meds have taken effect, the medical staff will sedate your pet through an IV catheter. This also allows technicians to give your pet IV fluids during the surgical procedure. An endotracheal tube will be placed, allowing your pet to be connected to the ventilator, which breathes for them, allowing them to receive oxygen and anesthesia during the procedure. Your pet's belly is shaved and cleaned to make it sterile for the surgeon. The duration of a laparoscopic surgery depends on the size of the pet. The bigger the dog, the longer it takes, just like a regular open surgery. Your pet is monitored during surgery by trained technicians whose only job is to monitor your pet. They record your pet's oxygen level, amount of anesthetic gas that is given, their carbon dioxide levels, blood pressure, and heart rate. This constant monitoring, as well as the recommended pre-anesthetic blood work and EKG, help ensure your pet's safety during the procedure. The space surgery, where we prefer to use the laparoscope, is called an ovariectomy. This is a type of space surgery which has been proven to be as effective as the open ovariohysterectomies more traditionally performed. An ovariectomy removes only the ovaries. The ovariohysterectomy removes both the ovaries and the uterus. Using the laparoscope to remove the ovaries enables the surgeon access to the abdomen, making two very small incisions, as opposed to the traditional space surgery where the ovaries and uterus are removed through a longer incision. The larger incision increases the post-surgical pain and recovery time, whereas the smaller incision from using the laparoscope cuts a patient's recovery time by more than half. Smaller incisions also mean less pain for your pet. Another surgery where the laparoscope is invaluable is the gastropexy, often performed on larger dogs to prevent gastric dilatation volvulus, or GDV, or bloat. The surgeon tacks the stomach to the body wall to prevent it from flipping or turning over, often causing a type of obstruction called bloat. This is a life-threatening condition more commonly seen in large, deep-chested dogs like German Shepherds or Great Danes. A laparoscopic-assisted gastropexy is often done at the same time as an ovariectomy or a traditional neuter surgery. Again, using the laparoscope for this procedure shortens healing time, decreases pain, and creates smaller incisions as opposed to the traditional gastropexy, which requires a much larger incision. As in most traditional open surgeries, your pet will be able to return home the same day after waking fully from anesthesia, usually after 4 or 5 p.m. With either surgery, your pet is sent home with pain medication. Your pet will also have received pain medication prior to and immediately after surgery, as our doctors at Animal Hospital of Statesville believe in preventing and managing pain before it starts. This benefits your pet immensely and makes them much more comfortable post-surgery. You will receive instructions about caring for your pet post-surgery during your pet's discharge from the hospital. If you notice anything unusual or have any concerns, never hesitate to contact us at Animal Hospital of Statesville. We are here to help you and your pet. Laparoscopic surgery has become the norm in human medicine as a standard of care. We are proud that we can offer the laparoscopic option to help our patients recover more comfortably and get back to being active and playful members of our families as quickly as possible.